Yeah, I want to give a little talk about UTI infections, urinary tract infections, because I had one and I was surprised. Well, the reason I got one was because I had a blockage due to a prostate problem, right? And they had to put this catheter in, and the VA was fast. I went to the VA after that because that's what I should go to rather than a regular hospital, right? And I never go to emergency, never. The first time I had one, really. But the thing got infected, right? So they put a three-way catheter in it. Then I got blocked up, and then the way the guy took it out, it was like, wow. And it really got bloody and infected really bad, right? It was like, you wouldn't believe it. And I started thinking to myself, it's a good damn thing I work out because I needed the strength to stay up late, to lift myself up. Because if I didn't have all that extra strength, I probably would have been screwed. That's one point about working out. But anyway, you can get catheters like this. I pointed one out. This is a thicker one. This is an 18 FR, which is 6 mil thick. 14 will work, It's got a tiny little end on it for an emergency. But, actually the people that get these problems more are women, not actually males. Males don't get the UTI as easily as women because, where the pee comes out is closer to where the poop comes out. And that's partly how it can happen. But I want to say something. I didn't take the antibiotic right away. That was one mistake. Because I was drinking lots of cranberry juice. Probably 2 liters a day. You know what? That did not stop the infection. And I've been reading that apple cider vinegar is a lot more powerful than cranberry juice for stopping the infection. That's why I decided to give it to my cat a little bit every day. I'll do coconut oil one time, then apple cider vinegar. He can't talk to me what's wrong if something ever happened to him. But you know what saved my butt on this thing big time? Colloidal silver. Now you could take colloidal silver orally, right? Now, if you can get it right at the part of the body, like this is a syringe. Now it should be sterile, but if you put it in colloidal silver, it'll be sterile. The other way to sterilize this syringe is if you put this syringe in water and you put it in a microwave till like water boils up, everything in it's killed. Let it cool down. But probably the faster way is using colloidal silver. But what I did, this was a 3-way catheter, and I injected. The guy told me to do 20 milliliters, which is this is 100 milliliters, so it's about a fifth the size of this. The markings wore off of this one. But 20 milliliters, but I was doing about 50. And I'd push it in, and I'd try to pull it out, push it in, pull it out like this, short little bits. That's what cleaned it out. And actually I put probably 1.5 gallons or more of colloidal silver through my bladder. It was clogged with blood like crazy. It was clogging this thing up, and I wasn't going to go back to the emergency room again because they made it made it worse, man. I was like, fuck. I said, that guy shouldn't have pulled that out. He was like, 1, 2, on a count of 3. 1, 2. It was out between 2 and 3 seconds. In other words, this thing got ripped out inside of a second flat, and that kind of messed me up. But what saved my butt was the colloidal silver. I was injecting it. And I'm saying this because when Obamacare comes up, you're going to get the big know-it-all fuckheads doing all this shit, and they don't know what they're doing. Colloidal silver, I'm sure medical people know about colloidal silver. It actually kills everything. But when you take it internally and orally, you're not going to get it I was taking it orally too. Pretty good amounts, but it didn't stop the UTI, the urinary tract, the bladder infection, right? But what I think really cleared it up was I able to inject it into the bladder, then extract it, inject it into the bladder. And you got to be careful. You don't want to blow up your bladder with this thing. What I'm saying is you got to put it in there a little bit like this. You try to move it back and forth. And that was what got the blood out because it was constantly clogging. You got to just keep working it back and forth. And I did probably at least 1.5 gallons of colloidal silver. You know what? It went from extremely bloody, clogged, big sheets of blood. It was coming out between the urethra and the penis and the tube itself coming out, like big sheets this long, 1/2 inch thick, like all kinds of blood, right? The colloidal silver saved my butt big time. Big time. And I got to put this out here because I don't think it's going to be a popular video, but just think with this colloidal silver. Remember I said something else with if you have this lung infection and it's deep down in your lungs. You got bronchitis, and they're giving you all these antibiotics. The problem with antibiotics, it kills the good bacteria, which processes all your food that you use to break down vitamins and get all the enzymes out. Antibiotics kill everything, so it's actually bad. It actually kills your immune system. But sometimes you need them because it's such a bad bug. But you can't keep taking antibiotics. But with colloidal silver, if you can get it right on the spot where the infection is, like I said with the bladder, if you could, inject it into the catheter carefully, get all the air out, and you put in like maybe 20 milliliters, cc's, and you go back and forth, and that gets the chunks of blood out. And I did like 1.5 gallons or more of this stuff, about 6 parts per million. Now the lungs, if you can you can breathe it in on a warm air mister. It's not a vaporizer where it turns into steam, but a warm air mister that's designed to put medicine in it. What you can do then is it gets directly on the lungs. If the colloidal silver gets directly on an infection, it'll wipe it out. If you take some orally, it's not doing a lot of good. It's not bad to take, but it's not doing you a whole hell of a lot of good. Now, if you have a cut on your hand or something like that, you can actually moisten the cloth with colloidal silver, put it on there, and that'll clobber it, probably with some coconut oil. But I want to say this. I think this is what I've been hearing reading anyway, is much more effective on a UTI, the bladder infection. I drank 2 liters of cranberry juice every day with colloidal silver and still got the infection from the catheter. So, but I think and it got really, really bad, man. So I think cleaned it up was actually being able to inject colloidal silver into the bladder and, extract it. Not like that, though. There's no water in here. That's why it pulls out so fast. But you can actually pull this out all the way and rinse it out and then put more colloidal silver in it. But you'd have to maybe you want to do like no more than 20 milliliters or 20 cc's. But I was doing 50, but just a little bit at a time. But I was making sure I was extracting, that much. But you have to work it back and forth like this because there's blood clots. If you look at the size of this end, you see how small that is? To go through the blood's got to go through there. There's all kinds of clots. It's difficult. It gets constantly clogged up. But what's killing that infection in the bladder is if you got the colloidal silver right on there. If they were using that in a hospital versus saline solution, which is good for knocking out bacteria, saline solution, the colloidal silver would have done a much better job. But you know how it is. They're starting to use some silver in hospitals for sterilization of equipment. They're starting to use it for Band-Aids. It's in the bandages and stuff, but they're not using it that much. It's a slow process. What I'm saying is, if you got an emergency, with Obamacare, you're going to be fucked. Believe me, you're going to be, I'm just saying, excuse my French, but that's what's going to happen. So I'm putting stuff out here that I think is a lot more common sense. And if I come up with any more ideas, I say this saved me, using colloidal silver big time. Very, very important. And, right now I probably got a good gallon of it on hand at least, but I'm should be all right now. So, but just want to give that update because when Obamacare comes up, we got to fight Obamacare big time. It's BS. And if any of those people, medical people, are that cold-blooded, if they're just all about money, screw them. I don't want to say my thoughts. Well, I will say my thoughts. You could sit them on a freaking sharpened stick, To hell with them, right?